Assalamu alaikum, I'm Dr. Mahnoor and today the topic of our lecture is anticoagulants. The objectives of this lecture are to study the drugs used for coagulation disorders, the mechanism of action, uses, adverse effects and contraindications of heparin, warfarin, direct thrombin inhibitors and direct factor Xa inhibitors. Also to study the drugs acting as procoagulants. Drugs used in clotting disorders or drugs used to prevent clotting include anticoagulants, fibrinolytics or thrombolytics, and antiplatelet drugs. Anticoagulants include heparin, warfarin, direct thrombin inhibitors, and direct factor Xa inhibitors. Fibrinolytics or thrombolytics include streptokinase or TPA derivatives, whereas antiplatelet drugs include aspirin, ADP receptor inhibitors, glycoprotein inhibitors, phosphodiesterase enzyme inhibitors, or adenosine uptake inhibitors. Anticoagulants which we are going to study in this lecture are heparin, warfarin, direct thrombin inhibitors, and direct factor Xa inhibitors. Heparin can be unfractionated or low molecular weight. Unfractionated heparin with molecular weight from 15,000 to 20,000 Da, that is Dalton, or AMU, that is atomic mass unit, is derived from animal sources and is highly acidic in nature. Unfractionated heparin is given parenterally through IV route or subcutaneously. Low molecular weight, for example, enoxaparin, deltaparin, and tinzaparin are heparins with molecular weight from 4,000 to 6,000 Da or AMU, are also derived from animal sources and are given subcutaneously, whereas fondaparinux is another small synthetic drug given subcutaneously once daily. Now let's discuss the mechanism of action of heparin. You should know that antithrombin 3, which is a naturally occurring alpha-2 globulin, binds and inactivates clotting factors such as 2A, 9A, 10A, 11A, and 12A. This process is normally very slow. Now, the negatively charged heparin molecule binds to the positively charged lysine sites on antithrombin 3 and accelerates this reaction by 1,000-fold. Now, this complex of heparin bound to antithrombin 3 inactivates thrombin and factor Xa and other proteases. Heparin is safe to be given in pregnancy as large molecules cannot pass the placental barrier and is used when immediate actions are needed, such as when starting a therapy. Heparin is used in the treatment of pulmonary embolism, in prevention and treatment of deep vein thrombosis, also known as DVT, especially in patients who are immobilized that are bedridden. It is used post-operatively and in patients with stroke and leg fractures. Heparin is also used in ischemic heart disease such as unstable angina, post-MI, also known as myocardial infarction or heart attack, revascularization during angioplasty and stenting replacement, and for prevention of recurrence. Heparin is also used in atrial fibrillation, rheumatic heart disease, cerebrovascular diseases such as cerebral emboli, vascular surgery, prosthetic heart valve, and hemodialysis to prevent thromboembolism. Adverse effects of heparin include bleeding, hemorrhagic stroke, allergy or anaphylaxis, increased hair loss leading to alopecia, long-term osteoporosis that ends in spontaneous fractures, and heparin-induced thrombocytopenia, also known as HIT, H-I-T. Contraindications of heparin are patients with hypersensitivity, bleeding disorders like hemophilia, thrombocytopenia, severe hypertension, and intracranial hemorrhage. APTT, which is activated partial thromboplastin time, is used for the monitoring of heparin. APTT is not a reliable test for low molecular weight heparins as they have less effect on thrombin as compared to unfractionated heparins. Whereas fondaparinux does not affect thrombin at all. Therefore, APTT is useless in case of fondaparinux. In case of heparin toxicity, especially with unfractionated and low molecular weight heparins, the antidote which is used is protamine sulfate. Protamine sulfate is basic in nature and it makes a stable salt with acidic heparin. Direct thrombin inhibitors, which we are going to study in this lecture later on, can be used in place of heparins in case of toxicity such as HIT, that is heparin-induced thrombocytopenia, or allergy. In this slide, advantages of low molecular weight heparin over unfractionated heparin are given. Low molecular weight heparin have better bioavailability and longer half-life after subcutaneous injection, and therefore they can be given subcutaneously once or twice daily. They have dose-independent clearance, therefore clearance is simplified. They have predictable response, therefore there is no need of monitoring as such. They have lower risk of HIT syndrome and osteoporosis, therefore they are safer for longer use. Now let's discuss about warfarin. Warfarin, which is aquamarine, is a potent anticoagulant that inhibits the cofactor function of vitamin K. Factor 2, 7, 9, and 10, as well as protein C and S, are all dependent on vitamin K for their synthesis by the liver. Warfarin inhibits the production of vitamin K dependent clotting factors like thrombin and factor 7, 9, and 10. Route of administration of warfarin is orally. Warfarin is lipid soluble and can cross placental barrier due to the small molecular size, therefore it is contraindicated in pregnancy. 99% of warfarin is in plasma-bound form and it has cytochrome P450 related interactions. Monitoring is necessary because of its narrow therapeutic index. Patients on heparin are shifted to oral warfarin after 3 to 5 days. In this slide, we are going to study the mechanism of action of warfarin. As you can see, that vitamin K epoxide is converted into reduced vitamin K in the presence of vitamin K epoxide reductase enzyme. Now this reduced vitamin K is converting the inactive factor 2, 7, 9 and 10 as well as protein S and C into their active form. Warfarin inhibits vitamin K epoxide reductase enzyme, which consequently prevents the reduction of vitamin K, which is essential for activation of certain factors. Therefore, warfarin inhibits the production of vitamin K dependent clotting factors like thrombin and factors 7, 9 and 10. An important thing to note here is that warfarin has no effect on previously formed thrombus. Warfarin has same uses as heparin and other anticoagulants and is used when long-term anticoagulant therapy is needed, such as after discharge, a patient can use it at home with ease. Adverse effects of warfarin include bleeding, which is the most common and most serious adverse effect, such as epistaxis, that is bleeding from nose, hematuria, GIT bleeding, and internal hemorrhages. Also, warfarin can cause dermal vascular necrosis. Contraindications of warfarin include pregnancy because it is highly teratogenic and causes birth defects, such as fetal bone defects and hemorrhage in fetus. It is contraindicated in bleeding disorders like hemophilia and thrombocytopenia. For monitoring of warfarin's effect, PT, that is prothrombin time, and INR, which is international normalized ratio, is used. For warfarin toxicity, the antidote is vitamin K. And for immediate reversal, FFPs, that are fresh frozen plasmas, are given. Differences between heparin and warfarin are given in this table, such as heparins have large acidic polysaccharide polymers, whereas Warfarin has small lipid-soluble molecules. Heparins are given parenterally, that is through IV and subcutaneous route, whereas warfarin is administered orally. Heparins act in blood, whereas warfarin act in liver. Heparins have rapid, whereas warfarin has slow onset of action and is limited by half-lives of pre-existing normal factors. Mechanism of action of heparin is that it activates antithrombin 3, which proteolyzes coagulation factors including thrombin and factor 10A, whereas warfarin impairs post-translational modification of factor 2, 7, 9, and 10. APTT is used for monitoring of unfractionated heparin but not low molecular weight heparins, whereas prothrombin time is used for monitoring of warfarin. Protamine sulfate is used as antidote of unfractionated heparin toxicity, whereas protamine reversal is incomplete in case of low molecular weight heparins. For warfarin, vitamin K is the antidote. Also, FFPs are given in warfarin toxicity. Heparins are used in acute cases, whereas warfarin can be given chronically, that is, over weeks to months. Heparins are safe in pregnancy, but warfarin is contraindicated in pregnancy. Direct factor 10A inhibitors such as rivaroxaban, apixaban, and endoxaban are given parenterally or orally. They bind to factor 10A and inhibit its enzymatic activity. They are used for the prophylaxis and treatment of venous thromboembolism after hip or knee surgery, as well as prevention of embolic stroke in patients with atrial fibrillation. Their adverse effect is bleeding. Direct thrombin inhibitors such as buvalirudine, desirudine, and lepirudine, which are derived from leach protein hirudine, are given intravenously, whereas dabigatran is given orally. Agatroban is given parenterally too. Direct thrombin inhibitors bind to thrombin and inhibit its enzymatic activity along with platelet activation. They are used in heparin intolerance, for example, in cases like antibody formation, heparin-induced thrombocytopenia, or anaphylaxis. They are also used in prevention of embolic stroke in patients with atrial fibrillation. Their adverse effect is bleeding, and they are monitored by APTT. Now let's discuss procoagulants, drugs which are used to facilitate clotting. Procoagulants include replacement factors and reversal agents. Replacement factors include factor VIII, which is used for the treatment of hemophilia A, factor IX, which is also known as Christmas factor and is used for the treatment of hemophilia B. FFPs that are fresh frozen plasmas and cryoprecipitates are used for the treatment of hemophilia A and warfarin toxicity. Desmopressin and vasopressin are used for the treatment of hemophilia A as well as von Willebrand disease because they increase the plasma concentration of factor VIII as well as von Willebrand factor. Reversal agents include protamine sulfate, which is used as antidote of heparin, vitamin K, which is used as antidote of warfarin, aminocaproic acid and tranexamic acid, which are antiplasmin drugs and are used as fibrinolytic or thrombolytic inhibitors. Local vasoconstrictors such as adrenaline are used with local anesthetic and alpha agonists such as phenylephrine. They are used to reduce bleeding. Assignment question is differentiate between heparin and warfarin in a tabulated form. Thank you. If you have any question, you can contact me. Allah Hafiz.